12:30 on this lovely day, and Brian Dust playing the Stones over here because the new album coming out.
I heard that.
Played the new song Angry, which is kind of angry. It's a great song, though. It really is cool.
Does it get you motivated to, like, stay angry?
Not really. Jimmy Fallon asked him on the interview, he's like, what's this angry? What's this about? And he said, well, it's about being angry.
Genius level. All right.
It was good. But anyway, Dr. April's in the house here.
Hey.
F&M Pelvic and witness. Fitness and wellness and all that jazz.
Yes, it's multi-talented.
I don't know what you're doing here.
We do all that. Fitness, wellness, pelvic health.
Kind of goes hand in hand, doesn't it?
It does, yes.
All right, so you're in here once again to tell us some good stuff from Facebook Live. You didn't bring any props with you. So
no props today, sorry.
It's going to be language. You're going to tell them all about it.
Yes.
What's happening?
Well, what's going on? One thing I wanted to talk about quickly, just kind of a side note and a little bit of a soapbox for me.
Get on it.
I had a phone call this morning with a gym owner from Pana, Epoch Experience, and we were talking, and a lot of people don't realize women often don't go to the gym because they are scared of leaking.
Yes. With
exercising and running. But we were just talking, I saw a stat last week, 1 in 2 women don't exercise because of pelvic floor issues.
Oh, my.
So typically that's more due to like urinary leakage issues. And then I had another patient this morning was talking about slow pitch softball, and she was joking and saying, yeah, some of the ladies said that the number one gear that they have to bring to their softball games is their pads.
Oh, no.
And I'm like, all right, this needs to be talked about and discussed.
Huh.
So if you are a lady out there and you're not exercising or like to get back to exercise and are having leakage issues, that can be helped. It is not normal.
Mm-hmm.
So yeah, if you're having any type of urinary leakage, coughing, sneezing, laughing, urgency, pulling into the driveway, can't make it to the bathroom in time, any type of urinary leakage, our clinic treats it here in Effingham.
Very good. Yeah, you don't have to miss that softball game. You don't have to miss working out. You can do all that and all that horseback riding. Remember those videos? You can't horseback ride on that. Yeah, you can. You can do all that stuff.
Yes, and you don't have to wear black leggings and pads. Like, don't worry about what you're wearing. Just go exercise and enjoy it and not have to worry about the pelvic floor issues.
And even the gym owners recognize this, it sounds like.
Yes. So she was telling me, she's like, my husband was wondering why I was like partnering with you and why I had this phone call with you today. And she's like, do you not realize how many ladies in our gym have pelvic floor issues?
Wow.
So, yeah, it's an issue that's not really talked about. And so people can get help at our clinic at Effingham Pelvic Health. So if you're dealing with any urinary things, and for some women, it's also bowel issues. So some of our patients are dealing with bowel leakage, and they just go walking and they're like, I can't make it to the bathroom in time, or they feel like they're going to poop their pants. Those are all issues that we help with.
That is not a pleasant experience.
No, it's not.
No doubt about it. So, yeah, if you've got any of those problems, be sure and see April and the gang there at F&M Pelvic. They can help you out on that and get your life back to reasonably normal. How about that?
Yeah, so that's really not the topic I wanted to go on today, but it was
but
like
that's a good one.
Driving here, I was like, I need to say this.
Sure.
All right. Well, you never know where you're going to hear something. It's like, yeah, I need to tell people about that. So if you have those problems, be sure and check that out. Now, what was your main topic going to be today?
Main topic, again, is going back to pelvic floor physical therapy for pregnancy and postpartum. Most people, this is a more relatively new topic for women that are pregnant and postpartum. Most people are like, what does physical therapy do to help with these issues? So I just wanted to touch on that a little bit because we do have the postpartum class I've been teaching for almost 2 years now. We have our postpartum class next week, Tuesday at Catching Glimpses, and that is a 2-hour class, and it's $25, and you can call Catching Glimpses to register. But this is for people who are currently pregnant or just recently postpartum, and we go over all the things that women need to know that they're not taught during pregnancy and postpartum time frame.
Could be the best $25 you ever laid down right here.
Yeah, it's actually a really good deal. And if you're a current patient of ours, you can go to those classes that class for free too.
Oh, even better.
Bingo.
Yes.
Wow.
But so with pregnancy, we've talked about this before, but pregnancy really should not be painful. I just had a new patient come in, and she's been dealing with pelvic floor heaviness and then some low back pain, and it's actually her SI joint is off. So low back pain, SI pain, tailbone pain, pelvic heaviness, urinary leakage, bowel leakage. What else? Pubic symphysis, so the bone in the very front of your pelvis. Sometimes people get pain there, getting in and out of their car, out of bed.
Oh.
All that stuff is not normal during pregnancy, and it can be helped.
Okay. So you got the exercises, you've got the treatments to make that all kind of go away.
Yes, and then for a lot of patients, for some things we may not be able to fully 100% reduce it during pregnancy. Our goal is to do that, but if it's like super severe, our goal is to at least minimize the pain so people can function and take care of the kids they already have at home.
Absolutely.
Or work without issues.
Very interesting.
Whoa.
You guys, it's come a long way in the last 10 years or so, hasn't it?
Yeah, it really is growing and expanding, and more people are starting to find out the benefits of it.
Well, that's the thing that I was just going to ask. You're talking about, look for this and that and all these symptoms and treatments or whatever. Now, 20, 30, whatever years ago, what did they do for anything? I mean, just ignore stuff and just say, well, wait till the birth and blah, 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 blah.
Exactly.
Yeah.
And unfortunately, that's still done a lot today.
Oh, really?
Aha.
Yeah. A lot of times patients have concerns and complaints about this, and they're either dismissed, like, oh, you're just pregnant. I've had patients say, well, my doctor told me that it was normal to pee my pants during pregnancy. I'm like, no, that is never normal.
Back in the old days, yes.
Yeah.
But we didn't know anything.
The only time it's normal is the first 6 to 12 weeks postpartum, if you're having some leakage then. But really by 6 weeks postpartum, you should be getting back full bladder control, not having issues where you're peeing your pants.
That's not a pleasant experience.
Yeah, no. So this is, it's our goal to really just educate women. And I'm hoping in another 20 years from now, this is very common knowledge. It's talked about. People know first thing what to do if they're having tailbone pain, if they're having pain with sex, if they're having urinary leakage, bowel issues. Their first thought is, I need to go to a pelvic floor physical therapist.
Okay.
Ideally, that's what's going to be happening in 10 to 20 years. But right now, we're not there yet. People don't know what we do. People don't know how we can help.
You're a trailblazer is what you are.
Trying, yes.
Like Daniel Boone right here.
Yes. And we actually had a recent review, and one of the patients was very honest and said, I was very skeptical coming into this appointment. I've been to multiple doctors. This was my last shot. She's like, I really didn't believe this was going to help me. She goes, but doing the breath work, which I thought was crazy, and doing some of these simple exercises and lifestyle changes has made the world a difference.
Wow.
We also had another male in the clinic yesterday, and the urology wanted to do a surgery on him. And all we did, we worked on some exercises, but really changed what he was drinking.
Oh, really?
And had him start drinking some water. Symptoms are completely gone.
Seriously?
Yeah, they don't even need to talk about that surgery at all anymore.
So no surgery, saved all that money on this surgery.
Yeah.
And got to do this. And
within a few visits.
Seriously.
Yeah. So that's our favorite is when we can just make simple lifestyle
make
changes.
You feel great.
Yeah.
Even I've picked up on that. You've said this on these interviews before, doctor, that, so many things are irritants for your bladder. And there's not many that have zero irritant properties. That would be H2O.
Yeah. You've got it.
That's
water is always good.
Yeah.
Water is
always go
good.
for the water.
Yeah.
And then for juices, I will throw this out there too, since we treat kids. For juices for kids that are having bedwetting issues, a juice that is not an irritant is apple juice. So cranberry juice, pineapple juice, things like that are all bladder irritants. But if you're going to do a juice, I don't really recommend juices, but apple juice would be the one to go to.
Okay, cranberry juice. I always heard that was good for your kidneys and stuff and bladder.
Okay, so they tell you to drink cranberry juice when you have a UTI because it is an irritant and it's going to clean your system out faster.
Okay, that's
so
how
it's
that
gonna
does.
It's going to make you pee.
So it's good for some things.
Yes, it is good for some things, but if you're having urinary leakage and severe urgency issues, I would not be drinking cranberry juice.
Yeah.
It's also good with a little vodka. You get it just right.
Hang on there.
Wait a minute.
And vodka's also a bladder irritant. Alcohol is, so sorry to burst your bubble there.
Double whammy right there.
Debbie Downer, bringing it all out.
But it's the truth, yeah.
But yeah, this is great knowledge that people really need to know. And that guy was going to have a surgery. Yeah. And then just a few changes in his diet and stuff fixed it.
Yes.
That's awesome.
And I also had a kiddo I've been seeing, and this poor kid. I think I talked about him maybe before, but abdomen was so bloated and distended, so much pain. And I saw this kid in the clinic this week, and his belly is back to looking normal.
Good deal.
And he's doing a lot better.
What did you have to do on that?
Oh, that was several different things, and we're still working.
Yeah.
But making sure he is drinking water.
Yes.
Because that's a huge thing for kids.
Yep.
And then trying to get in like a couple fruits and vegetables a day. And then there's this thing called ILU, abdominal massage. I say ILU, I love you.
Yeah.
I tell the kids, like, I love you. Like, your poop's going to feel better.
Yeah,
like,
it's
this
gonna
is
be
going to
great.
be good for you. But it's an abdominal massage that helps just get the large intestine moving. And I try to have them do that every night before bed.
Huh.
And that helps kind of get that poop moving through the system to help them have a better bowel movement. So those are 3 simple things: water, increase your fiber, fruits, vegetables, and then abdominal massage. And then, of course, I'm doing like some pelvic floor coordination with him, because I realize that for some people, when they're dealing with constipation, especially for kids that have been holding it in for so long and they don't want to poop because it's hurt before, they just tighten and hold it in, which makes it more painful when they go.
Sure.
So teaching these kids how to actually relax those muscles and relax their pelvic floor so they can poop easier, and then it's not going to hurt because they're not squeezing against it.
Get them that squatty potty. That's what I say.
That's actually another thing we did.
It's another deal.
Squatty potties.
I had a feeling that might be
Man.
part of it. Well, it's amazing when you're helping people, and you're helping kids.
Kids,
You're helping men,
women, pregnant women, postpartum,
It's great.
menopausal women, all the things.
All of the above can be
Yes.
taken care of by you guys there. That's amazing story what you've been doing and helping
Thank
out the
you.
people. That's awesome. And you've been good from the Effingham area. I'll tell you that right
Right
now.
on.
Thank you.
A lot of people getting helped. So if there are people out there experiencing these issues, how's the best way to get in touch with you guys?
Phone call's the best. We are open Monday through Thursday, 7 a.m. to 5 p.m. Our number's 217-705-5077. If you just kind of want to look into us more, you're not sure if you're ready to make that phone call, you can always look us up on our website, effinghampelvichealth.com, read a little bit more about us, or follow us on social media, Facebook and Instagram, Effingham Pelvic PT.
Very good. Well,
And we do not require a referral. So,
that's right.
yes.
And you even have gift cards available if you come into the store. Is that right?
Yeah, you are correct. Yeah, so we love talking about pregnancy, postpartum. We love recommending gift cards for moms for like a baby shower gift.
Oh, I bet.
Or a postpartum gift, because what's the best thing you can give to a mom is for 2-hour appointment for them to take care of themselves and address their issues
Absolutely.
postpartum. So we just had a mom recently buy that for her daughter who had a baby. So
that is an awesome gift.
Bingo.
And
Yes.
talk about feeling better after.
Yeah.
That'd be good.
yeah.
Well,
and
very nice.
Yeah. So yeah, call us if you want a gift card too. We can definitely do that.
You can always get them another swing or something, but nobody needs that many swings. You just get
Or
over and get
blankets or baby
Yeah.
toys or clothes. Yeah.
that. Yeah. Buy them that gift certificate and 8 boxes of diapers, and you'll be good to go.
There you go. That's what all moms want.
Well, Dr. April, always a pleasure to have you here and always informative. And you have a great day, okay?
I appreciate you guys. You too.
Hey, stick around. More fun coming up.